Welcome to another program of Focus on Health. And as always, I give a teaser. So this is my teaser. First of all, this is the first time I've done a show on gastroenterology. First time. And it's a really funny sounding word that we're going to talk about. So I'm going to let you think about that, and we'll get back on the other end of this commercial.
Each year, more than 350 million pairs of shoes are tossed in our landfills, taking about 1,000 years to decompose. So don't throw them out, donate them instead. Drop them off on these dates at these locations and we'll send them to developing countries around the world. It keeps them from taking up space in our landfills and helps provide footwear to those who really could use it. Our goal, 1,200 bags of shoes of all sizes. Got a pair you can spare? Brought to you by the Keep Columbus Beautiful Commission and the WLTZ NBC 38 CW Jabama Diverse Power Community Green Initiative.
Well, if you didn't guess what that funny sounding word is, it's GERD, G-E-R-D, and it stands for gastroesophageal reflux disease. And I have with me my gastroenterologist who I've had for my wife and I both for 21 years. You know, doctor, I didn't realize I was your patient for 21 years, since 96. That's a long time.
That's correct.
He's kept me very healthy, even though I haven't always been very good patient, but he's kept me on the right track being healthy. Dr. Patel, would you look into there and let everybody know something about you?
Hi, I'm Dr. Ashwin Patel. I've been here in Columbus for 23 years. My office is located right on the Talbotton Road, 1130 Talbotton Road.
And he is an excellent gastroenterologist. He's kept my wife and I very healthy. So if you want a good gastroenterologist, you're looking at one right now. Doctor, we're going to talk about a very, very good topic, one that, according to the stats that you have here, affects a lot of people.
That's correct.
And that's gastroesophageal reflux disease. Did I pronounce that correctly?
That's correct.
All righty. So let's find out something about GERD. First slide, please. Just exactly what is GERD?
Well, G-E-R-D, GERD, that is a gastroesophageal reflux disease. Now, gastro means stomach, and esophagus is a food pipe that takes food from mouth to the stomach. Mm-hmm. And when the stomach contains reflux up in the esophagus and gives you trouble and painful symptoms, and that is called gastroesophageal reflux disease.
All righty. I say, so that is what that big word means, gastroesophageal reflux disease. Okay, let's go to the next slide then. And there's a picture. How common is GERD?
Well, gastroesophageal reflux disease is very common. As a matter of fact, most of the people think it's just a part of the life. Giving you an example, if you have a heavy dinner or eat late and go to sleep, you get a lot of heartburn.
Right.
People go and take the medication and go to sleep. And most of the people don't even seek any medical attention. Mm-hmm. And in a Western country, we have a study done, and close to almost half of the population experience some kind of a heartburn, acid reflux symptoms at least once a month. Close to about 15% of the people, they experience heartburn at least once a week. Mm-hmm. And 7 to 10% of the people experience heartburn on daily basis. So it's very common. And if you can look at the next slide.
Okay.
The worldwide prevalence of gastroesophageal reflux disease symptoms, if you look at our USA, is one of the, USA has the highest number of prevalence of gastroesophageal reflux disease.
And that slide right there, doctor, is alarming. Because it looks, look at the USA, it's covered.
And you know the reason? One is obesity, second is our lifestyle, and third was the food habit. And that's what we're going to talk about today.
Oh, well, look, I'm excited about that because if you just look at the USA compared to a lot of the other areas, that is alarming.
But absolutely right. And let's look at the next slide now.
Next slide.
I think this is the cartoon of gastroesophageal reflux disease iceberg. And the bottom of the cartoon, you can see the majority of people, they get minor symptoms, infrequent symptoms, and they take over-the-counter medication, and they never seek any kind of medical advice. And that's the majority of the population.
That's huge.
Yes.
And they live with that without seeing any kind of a physician for any type of treatment.
That's correct. When these symptoms get worse, some people think about going and seeing a doctor. So the first they go and see their primary care doctor, and they take medication, and then life goes on. You can see the tip of iceberg, right? Small number of people. Those are the people that come to see a specialist like me and other gastroenterologists in a town, and those are the complicated gastroesophageal reflux
And see,
disease.
that's what causes all the problems then, because they wait for such a long time before they actually come and see a physician.
That's correct.
This is alarming. I would not, this is an eye-opener, because I would have never, ever even thought about that. But when you do look at that, you see how many people are living with the condition without being treated by a physician.
That's correct.
That's awesome. Okay, go to the next slide, please. How does reflux develop?
Okay, well, this is very interesting. Your all acid secretion occurs in the stomach. If acid stays in the stomach, it doesn't cause any problem.
Right, that's right.
The lining of the esophagus is different than lining of the stomach. So when all acid or any kind of acid comes up in the esophagus, you're going to have a problem.
Right.
But wait, we have a defense mechanism. There is a valve between your esophagus and stomach.
Is that what we call that LES
That's
valve?
called LES, so lower esophageal
Esophageal
sphincter.
right.
So that valve stays closed most of the time, not all the time. So this valve will prevent any kind of acid reflux up in the esophagus.
I see.
Now you have another defense mechanism. The minute you get acid reflux up in the esophagus, your esophagus contracts, and the contraction called peristaltic contraction, it pushes down all the acid back in the stomach.
Oh, wow, that's neat.
The next thing, your salivary gland that you don't know, it secretes a lot of saliva. It rich in alkali. So when you swallow, this saliva with the alkali goes down in the esophagus. It neutralizes all the acid.
Well, that is really neat. So
Now,
there's a number of mechanisms involved. The lower esophageal sphincter, which can close up. Then also, you have the saliva, which is alkaline, which helps to neutralize the acid. And you have the esophagus that will also, as you say, constrict to push the acid back down.
That's correct. Now we have another mechanism too. Gravity. During daytime, you are sitting up, standing up, walking. So minute you have acid reflux, with the gravity, it will go down. So you have a lot of defense mechanism, but when you have a more acid reflux than your esophagus can defend, that's the time you get acid reflux.
That's when you get acid reflux.
And let me add one more thing. At night, the salivary gland doesn't work as good as during daytime.
Bingo.
So you don't have that much salivary secretion.
That is exactly right. I didn't think about that.
And you don't have a gravity to help you.
That's
because
right,
you're laying down flat.
Because you're laying down flat. So I guess
So-
the majority of people then will have maybe increased symptoms then maybe with something like
That's
that?
why you have bad symptoms at night as compared to
Right.
daytime.
And
So
that makes a whole lot of sense right there. Okay, let's go to the next slide. What are the symptoms?
well, I think symptoms.
Next slide, please. There we go.
Symptoms. Well, you can divide symptoms and typical symptoms and atypical symptoms depending on how much acid reflux you have it and how bad it is. But as I mentioned earlier, that the lining of the esophagus is different than the lining of stomach. So when the acid comes in the esophagus, you're going to start damaging
Feeling
your
it.
esophagus.
Right.
So anywhere in the body you put acid, it will start burning.
It's going to start burning.
Burning, same thing. The acid comes in the esophagus, it'll start burning. Now, it burns in the chest, in the heart area.
Heart area.
So
First
that's
people-
why it's called heartburn.
Right. And some people think they have, like Mike was talking about, thought he had a heart attack even.
Yes. Well, the other thing, some people come with a chest pain, and you were talking about Mike. It's better to go and see a cardiologist when you have a chest pain because most of the people they make a mistake and they don't want to admit they're having a heart issue, so they blame everything on a heartburn even though they're having a heart attack.
Right.
If you have taken CPR class, there's a question about that one.
And there is a question about that. That
Yeah,
is
so
exactly
most of the people make mistake and they always blame on a heartburn or a gas.
right, rather than it being a heart attack.
Yes.
Right.
So when depending on how bad is your acid reflux, sometimes because of the damage, your esophagus doesn't work properly, so you may have trouble in swallowing. Sometimes you have people with the unexplained cough because of they stimulate your system and the lungs and cause unexplained cough. So a lot of times we see people they have constant coughing and they have an acid reflux.
Not realizing that it's the acid in the stomach that's causing it.
That's correct. And depending on how much is acid reflux, as far as acid is staying in the esophagus, this is what you're going to see. But when this acid goes all the way up in the throat, then you're going to talk about all atypical symptoms.
I see. So the atypical symptoms come in play then.
Okay. So let's talk about atypical symptoms.
Okay.
Well, if you have a massive acid reflux, and if you see the reflux is going all the way up in the throat, then depending on what this reflux is going to do. Well, most of the thing goes back in your esophagus and goes back in the stomach. But some will go in your vocal cord and the voice box, and it causes inflammation of vocal cord, and that's called hoarseness of voice. A lot of time people wake up in the middle of the night and they have a hoarse voice, so that's your acid reflux. And if you have more acid goes further down in your windpipe, in your trachea and in the lungs, it goes into spasm, irritates your lungs, and then you have an asthma attack, shortness of breath, so you wake up in the middle of the night feeling short of breath.
Feeling short of breath.
Because everything's going in the lungs. So that's one of the atypical symptoms for gastroesophageal reflux disease.
Yeah, I tell you, these are some of the things that you would not even think associated. A lot of the atypical ones,
That's correct.
especially when you say the laryngitis and the hoarseness and the sinusitis and stuff, you would not think those to be typically associated with gastroesophageal reflux disease. But so this has been really educational.
Well, I think a lot of time we see people that refer to us from a ear, nose, and throat doctor because what happens when you have too much acid in the throat, you have a constant, inflammation of the throat, you have a sore throat, then when acid goes up in the sinus, you get inflammation of sinus or sinusitis. Actually, if you have bad reflux, it goes all the way in your middle ear and cause inflammation of the middle ear called otitis media. And people will go to ENT doctor because they think there's an ear problem.
It's actually
it's a GI problem. And the last one, dentists, they'll pick up atypical reflux.
Oh, just from dental erosions from the acid.
Acid stays in the mouth and damage your teeth and cause you dental erosion. So this is a wide variety of symptoms you can have. It depends on how bad it is.
Trust me, I'm learning a lot about this as well as many of you in our video audience because I would have never equated the sinusitis or the otitis media or the dental erosions with GERD. So I've learned a whole lot. Dr. Patel is educating me more, but we're going to take a break and we're going to see you right back on the other end of this commercial.
Bicycles are fun at any age. Just remember the rules of the road when you're out enjoying a bike ride. And motorists, when you're sharing the road with cyclists, use caution and give at least 3 feet when passing. Bicycles are safe, fun, and sensible. When you ride, be visible, be predictable, and be alert. You'll have a safe ride and a great time. Let's get there together, Georgia. A message from the Governor's Office of Highway Safety and Georgia Bikes.
I am a teenager.
I am online.
I enjoy sharing thoughts,
Music, videos.
Ideas. Information.
I will not
I will not be a victim to threats.
to stalking,
to soliciting,
to predators.
I will be responsible.
I will be careful.
I will be honest.
I will be smarter. I would get my parents involved.
I will protect myself.
I will be safe.
I am a teenager.
And I
And I
Will not.
be bullied.
Welcome back to Focus on Health. We're here with Dr. A.D. Patel, giving us a lot of good information about GERD. Dr. Patel, we're just looking in and let the people know who you are again, right there in that camera.
Hi, I'm Dr. Ashwin Patel, gastroenterology.
All righty. And Dr. Patel has been giving us a lot of good information on GERD. Now, doctor, how do you treat GERD? How do you go about treating GERD?
Well, we have medicine, and you take medication, you get better, but that's not the question. Before you start taking medication, first you need to know why this is happening.
Sure.
And what can you do to prevent
Right.
the whole acid reflux sequence and complications. So yes, we have a lot of good medication. We give medication, people get better, but I emphasize more on changing the lifestyle, changing the dietary habit, find out what is causing a problem. So top of the list for the change in the lifestyle is weight loss. There is a strong correlation between the weight gain and severity of acid reflux.
I see.
If you gain weight, your reflux is going to get worse.
So the reflux, direct relationship between weight gain and your GERD.
Yes. If you lose weight, you get better, and you may not need even medication. So what happens when you gain weight, you put extra fat around your belly, and that is going to put a pressure on your stomach.
Right.
When you put a pressure on the stomach, it's simple physics, is going to push all the content of stomach up in the chest, in the esophagus.
And you're right, that makes sense.
Yeah. And second thing, sometimes if you gain too much weight, it might put a part of the push your part of the stomach up in the chest also. So the part of the stomach that goes in the chest is called hiatal hernia. So that even is going to make your acid reflux worse.
Come up worse, it's going to make it.
All the acid is coming up in the chest. And if you lose weight, the pressure goes away, and everything is reversed back to normal. So
And I think-
simple.
and I think that's what Mike said when he had trouble. He's lost weight. He hasn't had any more trouble since then.
That's correct. And talking about obesity, obesity is an independent risk factor for esophageal cancer. So
Oh, really?
There's one more reason to lose weight.
That's a strong reason to lose weight.
That's correct. And talking about the pressure on the belly, a lot of people, I see they wear tight clothes.
Yes.
Well, it does the same thing. You put a pressure on the stomach and it puts up all the acid in the chest. So avoid wearing a tight cloth.
Right. And I see a lot of that too.
That's true. And people gain weight, they don't want to show off, so they put tight clothes. But I don't think that's helping you.
No, it's not helping. In fact, it's making it worse.
That's true. So second thing on changing a lifestyle is smoking. Smoking is bad.
Yes, very bad.
Smoking will increase acid secretion in your stomach. So you have a lot of acid. And the valve that we are talking about, that separate your esophagus and stomach, smoking will open up the valve too.
Oh, that lower esophageal sphincter.
Lower esophageal sphincter will be open, and you have so much acid sitting in your stomach. So you have an open pathway for acid to come in it.
So that's a
esophagus.
direct relationship between smoking and that, because
So-
it affects the LES.
It affects LES, increase acid reflux, and again, smoking is a risk factor for esophageal cancer.
You're right.
So one more reason to stop
So
smoking.
stop smoking.
That's true. So if you are overweight and if you are smoking,
That doubled your risk.
yeah, you're asking for trouble.
Right, big trouble.
The third thing I would advise people about alcohol. Alcohol does the same thing. It increases acid in the stomach and open up the valve, the lower esophageal sphincter. So you have, people
So
drink
open channel.
open channel. You drink a red wine at night and go to sleep, you're gonna have a heartburn. That's a guarantee.
Right, that makes sense. A lot of people drink red wine in the evening.
And then go to sleep and they have a heartburn. So those are the three important part of changing some lifestyle, but there are a lot of other things you can do to prevent acid reflux. The one that I like to advise people, and it works so good that I mentioned earlier about advantage of gravity.
Yes.
So we need to use that advantage of gravity. So let me explain you. If you're laying down like this one, and this is your chest, this is your belly, and this is your head, if you're laying down flat, all the acid from the stomach will come in your esophagus.
You're right.
But if you elevate the head of the bed, now you're sleeping like this one, so with the help of the gravity, it will prevent acid reflux going up in the chest. And if it goes up, it will come down.
And that's an easy thing to
That's
do.
an easy thing to do. Only problem is your spouse will agree to sleep like this. And
You're right. That's the only difficulty. But if it's going to help the GERD,
Yeah.
elevate the bed.
So, but we have a solution for that one. See, normally you use a pillow to raise your head. That doesn't help you. But now we have a wedge pillow, will elevate your back and head both. So you have a safe advantage, and you can sleep with the
And your
spouse
wife
without
don't have a
disturbing.
problem.
No problem.
Use
So-
a wedge pillow.
So this is very important when you have a nighttime reflux and the medicine is not working, that will help you. The other thing is when you sleep on the left side, that the lower esophageal sphincter will stay closed. With the help of gravity, that's why it drops down and stay closed. If you sleep on the right side, it will stay open.
I didn't know that.
So you try to sleep on the left side, you're going to see a big difference.
Boy, I'm telling you. And Mike, I know you're listening. You're not having trouble now, but that's an easy tip right there. I didn't know that, doctor. You really, was another lot of things you've told me. I don't know, but that is an easy thing that any person can do. This is some really good information that we're receiving right now, by the way, from Dr. Patel.
Well, thank you. So we have a lot of other things to talk about. What else can you do? So other thing is, I advise people to avoid lay down for 2 to 3 hours after they have the regular big meal. So what happens when you eat, the food goes in the stomach will start secreting a lot of acid. And this is a part of the digestion process. As long as the food is in the stomach will keep secreting acid.
Right.
And also, it will open up your valve a little bit more than usual while the food is sitting there. And normal size meal, in about 2 to 3 hours, most of the food get empty out from stomach and the small intestine.
Okay, after 2 or 3 hours.
So now, right after you finish your meal, you have a food sitting in the stomach, your stomach is secreting a lot of acid, your valve is halfway open, and you lay down. You know what is going to happen.
Yes, indeed.
All that is going to come
It's
up
going
and
to come
test.
up there. And doctor, that's a good point because I don't know how many people will eat and then go lay down and do this here with the TV, and then while they're watching the TV, they go to sleep and the TV's watching them. And what's happening is that acid is building up into
That's
the
correct.
esophagus. So you said about 2 to 3 hours after a meal. Pretty much it's in the intestine.
Well, there is some catch to that one.
Oh, it is?
Yeah.
Uh-oh, there's a catch now.
Okay. Well, after 2 to 3 hours, most of the food is gone down in the intestine, so your stomach is not secreting acid, and you're fine. But 2 to 3 hours is for the normal size meal. If you have a huge meal,
If you're having a huge meal, it's going to take
it's going
longer
to
than
stay for
that.
several hours. Sometimes you see people come in the morning, the stomach is still sitting in the stomach. Food is still sitting in the stomach.
Because they ate such a huge meal.
Yeah,
right?
huge meal. So bigger the meal is going to take longer time for your stomach to empty. So if you go on a smaller size of meal, it's going to take shorter time to
Shorter
empty.
time.
So advice is you don't have to have a big meal all the time.
No.
Small meal 3-4 times a day is better than 1 or 2 big meal.
So that's another thing that people can do
Yeah.
is to eat a couple of smaller meals rather than just one huge meal. And that allows the stomach a chance to digest the food and it go into the intestines. There's a lot of good lifestyle things that we can do without taking medication. And that's huge because we're in control of that. So that's a smart thing to do.
So there's another thing too about a 2 to 3 hour business. Well, it depends on what you're going to put in your stomach.
Oh, the type of food.
Yeah. If you put food loaded with oil and fat and grease, it's going to stay in the stomach for a long time. It's going to take a long time to empty.
That is right. I forgot because fat does stay in the stomach longer.
Yeah, and it also increase acid secretion and also relax the valve between the esophagus and the stomach.
Also, the fat also relaxes that LES, that
That's
valve.
correct. So you have a lot of things to do here, and on top of that one, you can do some, change in the diet. Now, diet is not that strong, but there's a long list of the food I can tell you that can give you acid reflux, but not all food can give acid reflux to everybody. So you have to figure out which food is causing problem to you.
Yeah, well, you can pretty much identify which foods give you the most problem.
That's correct, but that includes any caffeine, coffee, tea,
Oh,
pizza sauce, spaghetti
Doctor's
sauce.
hitting home. As much coffee as I drink, he's hitting home. But yeah, because coffee, I heard it does stimulate it, doesn't it?
Yes, coffee stimulates acid and gives you acid reflux. Tea, even citrus juice, pizza sauce, spaghetti sauce, chocolate, even onion can, some people eat onion and they have
And
acid
they have
reflux.
acid reflux.
Acid reflux. So there's a lot of things you can, figure out which food is causing a problem. It's not going to cure your problem 100%, but it will help you. And the last thing I want to talk about, sodas. We can discuss for a whole day about a soda,
Uh-oh, this is going to be interesting here.
but I would request stay away from soda. It doesn't matter what kind of soda you have it, dark or clear, caffeine or no caffeine, diet or regular.
Wow.
I don't think it does any good to you. You should drink water. Throughout the day, you should drink 5 to 6 glass water. And you will be pretty much hydrated. You don't have to look for any other thing to drink.
Yeah, but you want to know something that is true? I've kind of weaned. I used to be a heavy soda drinker, pop, but right now, within the last couple of years, although my gastroenterologist has been harping on me to do it more, but I've just been more obedient. I started drinking more water as he's advised me to do, and it has. I can feel it in my body a lot better. Not only am I hydrated, but it also water is a lubricant too, and it helps. So I finally listened to what he's told me after the past 4 or 5 years, although I've been seeing him for 21 years, and it works. We're going to take a break right now, and we're going to come back again with Dr. A.D. Patel, who's given us a lot of good things that we can do ourselves not to have GERD. See you on the other end of this commercial.
Come on, let's go.
Hey, hi, what's your name? You live around here? You're pretty. Where are you guys going? Where are you going? Where are you going? Where are you going?
Guess it's about time to get you fixed, sweetie.
Your pets will start getting noticed sooner than you think. Accidental litters lead to millions killed in shelters each year. Help prevent more. Fix at month 4.
And welcome back to Focus on Health. We're here with Dr. A.D. Patel, my gastroenterologist. He's given us a lot of good information. I'm a big believer in changing lifestyle and empowering the patient. And he gave a lot of good information on things that we as individuals can do to control gastric reflux. And so, doctor, where we did lifestyle changes, how are we as far as medications?
Well, we have a variety of medication, but I'll divide medication in 2 different groups. One, very mild medication that will just neutralize the acid.
Okay.
And those medications commercially available, like Tums, Mylanta, Melox kind of medication. So this medication works fast. It neutralizes the acid, but it doesn't decrease acid secretion. So it's good for very mild reflux and very infrequent reflux.
Okay.
We have other group of medication that will actually decrease acid secretion.
Okay, so that will decrease the acid secretion.
And we have 2 groups in that one. The one older group that I've been using for 30 plus years is, and I would put as a milder group. What happened, the acid is secreted from different channels and pathway in your stomach, and one of the most common pathways called histamine 2 receptor pathway. And so in the short form, it's called histamine 2 or H2 receptor. Mm-hmm. And if you block that H2 receptor, you will decrease acid secretion in the stomach.
That makes sense.
And a lot of variety of medications we've been seeing now is over-the-counter medication like Zantac, Pepcid, Tagamet. So those medications are good. They cut down a lot of acid in the stomach, but it doesn't last for whole day, so you end up in taking twice a day.
I got you.
And the last group that cut down almost all the acid in the stomach is a good medicine. It's called proton pump inhibitor, and commercially available. This medication, the commercial names are Nexium, Prilosec, Prevacid, Daxxelan, Protonix, and all those things. So, and this medication we've been using for 20 plus years nowadays. So, and this medicine works so good. You just need to take it once a day.
Good.
Take early in the morning, and that takes care of all the problem.
Great.
So you have to decide how you're going to use this medication, depending on how bad is your acid reflux. can you change your lifestyle, can you change your diet, and you use a different kind of medication. And you don't have to keep taking the same medication forever. You have to go back and forth, change which one is working. Can you go from stronger to lighter or lighter to stronger? And that's what medication
So
is.
that's pretty good. So you do have, as a physician, flexibility depending on the individual person's position or their symptoms, what they bring.
That's true.
So that's pretty good.
And you know, the medicine works most of the time, but small number of people we send for surgery.
Oh, I see.
Not you
Not
don't
many, just a small percentage.
very small percentage, because you know you cannot fix everything by surgery, and you want to make sure you change a lifestyle, use medication, because you know surgery has its own problem.
Right. And,
So-
and not only that, but the list of things that you gave us that we can control as individuals are huge. We just have to have the knowledge of it. And I learned so much just from some of the things that you've said.
Okay.
So surgery is really the last resort.
And there is, you know, the reason we don't use surgery that commonly because the good medications are there and it comes with a complication. But only few number of the people are, you know, that if you require high dose medicine on a long-term basis, or if you are young and you don't want to take medication, I think that you should consider surgery. Or if somebody has like atypical symptoms, has too much reflux and goes in the lungs and
Right.
cause asthma, you want to go for surgery
Sure.
to prevent problem. And what they do, the basic principle about surgery is our friend lower esophageal sphincter, the
Right.
valve. The surgeon goes and make it tighter. So when your valve is tight, it doesn't open, doesn't relax, so no acid is going from stomach up in the esophagus.
Right.
Well, you can have some complication of the surgery too,
Yeah,
because
because
nothing
if
is free.
Right, because then nothing
Yeah.
gets right.
That's true. So you know, usual complications are there of surgery, but think about it. When you eat, when the food reaches down at the bottom of the esophagus, the valve opens and food drops in the stomach.
Right.
Now here, the sphincter is
That's
tight.
what I'm saying,
and
right.
it's tight, so sometimes the food you're going to have difficulty swallowing your food.
That's exactly right. That
Definitely.
makes it even bigger problem.
Yeah. The other thing, when you eat food, you probably know that middle of the meal or after a meal you burp.
That's it.
Burping is if you're, you know, a lot of air accumulated.
Oh, that's right.
Yeah, so, you know,
So if that lower esophageal sphincter is closed, you got a problem.
well, I mean,
it's
normally
got to go someplace. So
you just cannot burp.
it's got to go out the other
and
side.
it takes time to come out from other end.
Right.
So you're miserable, you know, it's a pain,
it's
bloating.
pain, distension, yeah, it's
It's
bloating and all
very
that.
troublesome
That's
symptoms.
a problem.
So, you know, surgery is good, so you want to put a surgery for the special occasion, not for routine, say, hey, I don't want medicine, I want a surgery.
So all the good information that Dr. Patel gave us about lifestyle changing, about elevating the bed, about waiting 2 or 3 hours before you lay down between a meal, about a number of small meals instead of one huge one, those will make it possible for you not to have surgery and to live more comfortably with GERD throughout your life, or maybe not even experience it at all.
That's correct. We can go to the next slide.
So we go to our next slide, please. Side effects of medication.
Okay, well, I think the first group of medicine that, you know, just neutralize the acid, it doesn't have that much side
Doesn't have
effect.
that one. Those were the
because-
H2
yeah,
receptors.
no, that's like Tums and Malan.
Tums and- just
People don't-
antacids.
Yeah, antacid. The H2 receptor blocker, Zantac, Tagamet, they have some drug interaction, but, you know, we've been using for 30 years, no major side effect.
Great, great.
Now, talking about proton pump inhibitor, the big gun, Nexium, Prilosec, Protonix, Dexron, those medicine, before I say about side effect, let me tell you something about medicine. This medicine is good. You take one in the morning, you have a good time throughout the day. The problem is, you know, people come with a severe acid reflux, they are miserable, we put them on this strong medication, they feel good. Now, they used to avoid all the food and everything that was bothering them.
Right.
Now they start eating same food that now is not bothering them.
Right, right.
So they keep eating all the bad food and keep taking medication. And after a few months, a few years, now they say the medicine is not working. I need twice a day.
Oh.
So that's what is bothering me here, because what we need to do is you take medication and then you think about it, what can I do so I don't have to take medicine, rather than now I can do everything.
Yes, but see, but then I know what you're saying, and it's a very good point. Because they're feeling well, they still need to lean on the lifestyle changes
That's correct.
and not solely on the medication.
And that's why I need to know side effect of this medication.
That's okay.
We've been using for more than 20 years now, and initially we thought there's no side effects. But now after all this year, we have come across a lot of side effects. And that's why I want to tell you about how good is the medicine, but
also,
you have to be cautious.
Yeah, if some individuals, if they overuse them.
That's correct.
Okay, so what are some of the things
So,
that
you
they
know,
have to
when
be
you're on
careful
this,
of?
when you're on this medication, you are at increased risk of developing a certain intestinal infection, and particularly Clostridium difficile. This is very common infection when you go to the hospital or when you take antibiotic. But when you're on this medication, proton pump inhibitor, your risk is higher to develop this infection.
I got you.
Okay. Certain pneumonia, you are at a higher risk to develop certain pneumonia while you're on this medication.
Okay.
Now,
If you overuse it or abuse it.
well, even staying on this medication, sometimes because you cutting down the acid in your
I got
stomach.
you. Okay, so it changes your normal
Flora.
flora.
Normal environment has changed in your
Gotcha.
system,
I
and
got you.
so you increase the risk of developing some certain pneumonia. Now, because you're cutting down all the acid in the stomach on a long-term basis, sometimes you're going to have a problem with the absorption of certain nutrient. If you may develop anemia because sometimes you cannot absorb vitamin B12.
Gotcha.
Sometimes you cannot absorb iron, so you may see people with anemia. Magnesium is another thing that we see people has problem absorbing magnesium, and you have a lower magnesium.
I got you.
The third thing is the calcium. You also have no problem with the absorption of calcium. Now, if you don't have enough calcium, your bone get
Your
brittle.
bones get brittle.
You're going to have a hip fracture. There are a lot of study has come out that increased incidence of a hip fracture, and so you have to be careful.
Careful for them.
Yeah, the people now has developed some kidney damage. They develop
Wow.
interstitial nephritis, and they have a kidney issue. Now, this is not to scare you,
No,
but recently I have read about you can develop dementia even. And early Alzheimer. Can you
oh my
believe?
goodness, are you serious? But let
What?
me tell you something. That it behooves individuals that when they start taking this medication and they're feeling better, still remember that they have to watch their eating, the types of foods they're eating, the amount of food that they're eating, the positions in the bed that do all the things that they were advised to do prior to putting on regular they need to also include that in their normal medication regimen.
That's correct. So you anytime you have a problem, you need to find out why I have a problem and what can I do to prevent problem.
And that's why it's always good. Dr. Patel schedules my wife and I for regular visits so he can keep us up with it. My wife does a very good job. I have not always been a good patient, but he's given me the good, and I've learned to listen. So let's go to the next slide.
Okay.
Next slide. We did, complications of GERD.
Okay. Well, I think we look like reaching to the end. But people say, I don't want to take medication, I don't want to do anything. Then what happened? Well, when acid comes in the esophagus, it's going to damage your esophagus. So you have to take care of things. But if you don't take care of things, then the acid is going to start burning a lining of the esophagus, and you may end up having a lot of inflammation, and then you can develop ulcer there. When ulcer get deeper, it can erode into any blood vessel. You may end up bleeding from the ulcer. If an ulcer stays there for a long time, it starts forming a lot of scar tissue. And the scar tissue ultimately will create stricture.
Right, so that the tissue don't move.
So when you eat, normally esophagus is a muscular, and if stretched, now you have a scar tissue, you can't stretch, so you have trouble in swallowing. So those are the two common complications, but now you have prolonged exposure of acid in your lining of the esophagus, then the lining will start changing. It start looking like a stomach lining.
Wow.
And this condition is called Barrett's esophagus, is the name of the
Barrett's
person, Barrett's
esophagus.
esophagus. And it's not a cancer, but we put as a precancerous condition.
So it's a precancerous
Precancerous condition. So with the acid reflux, you can develop precancerous condition like Barrett's, which ultimately is not that common, but that can turn into cancer. So we have to check them more often. You know, every 3 years we go back and check it, make sure we biopsy, make sure nothing is
Make
turning
sure
any
everything's
bad
fine.
thing. And one that always scares me, the complication of gastroesophageal reflux disease, is esophageal cancer.
Yes.
It's a preventable cancer if you take care of yourself, but if you don't take care of yourself,
It's difficult.
it's difficult. And you know, there is a meta-analysis study has shown that the people who has once a week acid reflux, the odds increase to 5 times for esophageal cancer.
Wow.
And if you have acid reflux on a daily basis, odds increase to 7 times for esophageal
That's
cancer.
awesome.
And if you have acid reflux for many years and you have bad acid reflux, you know you are at a higher risk to develop
Yes.
esophageal cancer.
That's those odds you want to stay away from.
Yeah, and I can add a couple more things on that one. If you have a bad acid reflux and you are obese, overweight, think about, I mentioned it has an independent risk factor
Right.
of causing esophageal cancer.
So that increases your odds more.
Yeah, and how about if you're smoking on top of that one, you have your answer.
That increases it even higher.
So I think
First of all, an ounce of prevention is worth a pound of cure.
that's true.
And I just want to thank you. Can we put the slide up to where doctor's office is at in location? There we go. This is where Dr. Patel, A.D. Patel, is located. And I will tell my audience, 21 years, since 96, when I got out of the military again for the second time, I've been going to Dr. Patel. And I'm healthy. He's kept me healthy. He's given me a lot of good information. He's given me a lot of even more additional information that I didn't know about sleeping on the left side. And so, Dr. Patel, I just want to thank you for taking the time. And please, don't let this be your last time, because guess what? With gastroenterology, there are a number of topics that we can talk about. Gastritis is one, irritable bowel syndrome, which I have, which 2. There's a number of gastrointestinal, so he's done such a good job. I'm going to ask you to think about a date in January or February to come back on our program, and you'll see this program. You're going to see it, and you're going to see what a fantastic job you did. And if in December or January, I'm thinking January now is when I have an opening, if you can bring a topic, a gastro topic, that you can do as well as you did this program here.
Let me think about it, please.
So he gave me over 3 years. I've been after Dr. Patel to come and look at the excellent program. So if you know Dr. Patel and you go to the office, say, please, Dr. Patel, do another focus on health. Until our next program, I'd like to tell everybody, please take time to be good to yourself and take care of your body. Bye-bye.